Hi everyone, I want to talk to you today about multiple sclerosis. I tag it as the concern of many. Multiple sclerosis is a chronic autoimmune disease affecting nerves myelin with inflammatory process that is diffuse and resulting in sclerotic tissue. Nerve electrical impulse is disturbed and is commoner in females when compared to males at ratio 2:1 respectively. But when both male and female are affected, it is worse in men. When myelin is first damaged, they remyelinate. In other words, repair takes place. But repeated chronic lesions or plaques lead to the disease. Multiple sclerosis inheritance is not clear, but because there is no gene identified, but first-degree relatives have higher chances of developing the disease. In other words, we can now say categorically that gene number so is responsible, but it is seen over years that when the father has multiple sclerosis, the likelihood, or if the mother has it, the likelihood of the children developing it is higher. The environment is a big factor. For example, it is commoner in temperate regions than tropical parts of the world. Canada has a record number amongst the leading countries with multiple sclerosis. There are other factors already identified that could have enhanced it. Vis-a-vis decreased sunlight, increased fat, increased altitude. I mean, the higher people are on the land where they live, the more likelihood. Decreased vitamin D, increased chance of viral infection, antioxidants, and nutrition and hormones. What are the types of multiple sclerosis? Because it's not everyone who has been diagnosed with multiple sclerosis will be suffering the same way. There's what we call isolated syndrome in majority of people diagnosed with multiple sclerosis. So it comes in a blue moon and that's it. Relapsing remitting will occur between the ages of 15 and 20 years, and then secondary progressive at 40. In other words, it relapses and it remits. So from 15 to 20 years in most people, and then progress to secondary progressive at 40. Primary progressive, there will be an attack, there will be a relief, there will be another attack, but the other attack will be worse than the first one. That is primary progressive. Progressive relapsing from onset is getting worse after each flare or attack. And of course, permanent disability. What are the signs and symptoms? Destabilized mood. For example, depression. Destabilized thinking. For example, cognitive impairment. The individual is just confused, can't think straight anymore. Dysarthria. Language, speech trouble. Diplopia, double vision. Disturbance of muscles, muscle spasm, muscle fatigue, muscle weakness, muscle stiffness. and disturbance of vision with optic neuritis or nystagmus, disturbance of movement like ataxia, and dysfunctional bladder incontinence. In fact, most of the time, that is the first thing that will bring them to the hospital or clinic. Dysfunctional bowel, like diarrhea or constipation. Dysphagia, a swallowing difficulty. Disturbed sensation like tingling, burning, and excessive sensation to pain, and of course, neuropathic pain. What are investigations to be carried out here? Magnetic resonance imaging is the first of all investigations, and in fact is the one that is definitive, gold standard here. MRI plus gadolinium for brain and spinal cord. Then you rule out autoimmune with all the cascade of antinuclear antibody, rheumatoid factor, C-reactive protein, antiphospholipid antibody. Check the liver, complete blood count, thyroid function test, vitamin B12, CSF, for oligoclonal banding and visual evoked potential. You just do the lumbar puncture for cerebrospinal fluid. Then you look at oligoclonal banding and visual evoked potential. And of course, physical examination, you do complete neuro examination from head down to toe. Treatment here. The non-pharmacological treatment will involve physiotherapy, exercise, and deep brain stimulation. You can involve the respiratory therapist in respiratory training. The pharmacological aspect of the treatment involves some medications, but it's worth noting here that there is no cure. So between relapse and remission, you give your medication. If there is relapse or acute phase, you give methylprednisolone. Glatiramer is a good medication now, and interferon B. Disease-modifying antirheumatic drugs like teriflunomide, natalizumab, alemtuzumab, fingolimod, fampiridine, and mitoxantrone are all useful. Multiple sclerosis is a big concern for all the affected people, the caregivers, and loved ones who are supporting them. It is not their fault, so they need our joint efforts to make life bearable for them. I'm wishing all of them well. Thank you for listening to my presentation. If you subscribe to my channel, you'll be able to get this presentation as soon as they are published. Thank you.